First, thank you for the invitation to address your conference honoring Peter Drucker. My name is Steve Tarr, and I'm a fellow at the Peter Drucker School of Management in California. I'm also on the board at Evergreen Health near Seattle, Washington, one of the top health systems in the United States. It's my pleasure to talk with you because I've read Peter Drucker throughout my career. With some humor, Peter said that management is what turns a mob into an organization and human effort into performance. I always like that one. His principles endure throughout time because they focus on people working together in organizations for a functioning society. Yet, how can Peter's timeless advice help us in healthcare, especially during times of rapid technological change? When Drucker was a teenager in Nazi Austria, he personally saw what happens when people allow societies to destruct. This is why he was so driven to help people build healthy organizations for a strong society. Not management. Management is only a path to a strong society. People, organizations, and society are what motivated Drucker's work. I'd like to pause for a moment and show the real Peter Drucker, the person. This is his office in California. You can see in the black and white photo. He is working at the same modest desk where I took the color picture just a month ago. Standing in that room is truly awe-inspiring. You can feel the vibes. His house is a National Historic Site in the United States, and everything is pretty much as he left it. He answered his own telephone, and you can see actual handwritten manuscripts and his edit marks on the bookshelves. One little known thing about Peter is that he would joke, half serious, that he would work on any industry except healthcare. Why? Because healthcare customers are irrational. Everyone wants costs to be controlled unless it is me or my loved one as the customer. Then I will pay whatever it takes, or I want someone else to pay any amount. Yet he did have great impact on healthcare, and it continues today. So let's start by reviewing some foundational management principles and their ongoing importance. Then we'll go through a few topics about adapting healthcare in the digital environment and some current healthcare challenges. This is a picture of the Peter Drucker building on the campus. He even has a street sign named for him, Drucker Way. And it's really a nice place. If you have a chance to go to Los Angeles, you might try swinging by the campus. His enduring core principles, you can debate what they actually are because there are hundreds. There are many shorter lists, so I haven't included hundreds today for us to talk about. I've selected just 5. And here are those 5. The importance of a functioning society means that we are ethical and responsible for how society's needs are addressed. There's no room for narcissism in a functioning society because it just takes from people and organizations. And the organization must perform, but how? For their customers, the people they serve. And the people that work in the organization get social status and a sense of community through their work for the customer. I contribute, you contribute, we help each other. And notice, the healthcare serves customers, not patients. It's a simple, profound change in perspective. Drucker always addresses effectiveness, not efficiency. You can be very efficient, both time and resources, yet be solving the wrong problem. This creates total waste for the organization and does not serve the customer. Effectiveness solves the right problems. Management may evolve as society and technology changes, yet the principles are constant over time. They've been around for thousands of years. The same dilemmas and trade-offs have happened over the course of human history and will into the future, requiring anticipation of future challenges. He was not a traditional academic, researching and publishing in journals. He was active in the real world, an observer of what was going on and an analyzer of the dynamics. In fact, His autobiography is titled The Adventures of a Bystander. He was a management clinician, observing people and organizations as much as a healthcare clinician observes signs and symptoms. So let's take a look at how we can adapt for a digital landscape. Drucker coined the term knowledge worker, which is vital in modern healthcare. Every person in the process of delivering healthcare is something that we now know to be a knowledge worker. Historically, people only thought of doctors, nurses, and clinicians as knowledge workers. But today, we add to them everyone else in the service delivery chain, from intake to discharge, from lab tests to imaging, from food services to sanitary care. Technology helps people know when to provide these services, in what form, and in the right quantity, even down to automated notifications that a discharge has happened and the room has been refreshed and is ready for the next customer. Digital healthcare teams rely heavily on specialized knowledge, collaboration, and technology to deliver the effective care. We've all seen how our jobs have changed in the last 15 or 20 years. Each of them, digital imaging, lab diagnostics, electronic medical records, have dramatically improved healthcare outcomes for the customer. And the key point is, while science, technology, and medicine change, the basics of management are constant. Organizations serving people have always existed and always will, even as other fields progress. Often overlooked by the customer, or the patient as we mentioned earlier, is the impact of the pace of innovation on the care team, driving a continual need for new tools, changing process, and people adapting to it all. And people can look to regulations as burdensome overhead, but yet, well implemented, they are also the mechanism for safety and good outcomes. But all of this is part of the change that we have to manage. So Drucker Principles puts the customer at the center of healthcare, which is why we call them customers and not patients. By prioritizing the customer experience and satisfaction in every interaction, the result is effective and responsive care delivery and strategies aligned with customer needs. Customer, 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 all in red. So his principles apply to contemporary healthcare challenges. We know that, but in what ways? Well, in the early 2000s, healthcare organizations were beginning their journey to electronic medical records. Most didn't know the impact, for they'd never had so much data for each encounter, nor longitudinally for customer history, let alone population health data. Providers also did not have insights they now expect, and both customers and providers have benefited from data analytics. And now we have AI, a term with a very imprecise definition. The real technology underlying the term is constantly changing and very different, whether we're analyzing a diagnostic image or processing large population data sets. Yet the term's not going away, so it's the job of healthcare professionals to really ignore the term and ask, what is the underlying technology? And most importantly, how does this benefit the customer? If it does not benefit the customer, it is waste. We constantly hear about machines overtaking humans, and in many cases, their performance is superior. But as Drucker wrote about the knowledge society, he kept people at the core. He knew that spreadsheets had been calculated by humans with paper and pencil, and then more rapidly and efficiently replaced by Lotus 1-2-3 and then Microsoft Excel. But were the automated spreadsheets effective? Humans define effectiveness. Humans may ask for and get help from automation. We may agree that the sum of a column in a spreadsheet is calculated correctly, but it is up to us, not automation, to judge what that sum means and what it will be used for. This takes us back to the ethics of people working together for a functioning society, and not the Austria of Peter Drucker's youth. His emphasis is on mission, that you have clarity of your mission, clarity of purpose, who are your customers, clarity of the customer, what do your customers need, Clarity of results, how do you produce what they need? And clarity of the future, how do you manage the long term? In closing, Peter Drucker's management principles are powerful guides for healthcare leaders facing technological transformation. By adapting his vision, organizations can innovate responsibly, prioritize customers, and build sustainable futures. So once again, thank you for the invitation to speak with you, and I wish you the best.